medical history. The government can't step in and, you know, judge this or that and create just a mess, like you said, with education and what's going on right now and other forms of bureaucratic practice.
And just to be clear, we are not in favor of removing all assistance for like the very poor, those with pre-existing conditions, just most interventions.
We believe in consolidating most of our, you know, Medicare and Medicaid costs. Where we agree. We back CHIP and
Kids. We're for the kids.
and just eliminating what we would consider wasteful spending, rather than just saying, you know, oh, you're dying on the street. Oh well.
Yeah, we're not hard.
Okay, our plan mostly involves streamlining. Right now, any two hospitals in America don't pay the same price or charge the consumer the same price for any medical services. We have an article from the New York Times dated May 8th, 2013 that gives an example in a few cities, but we were focusing on the one in Florida. So it's a gallbladder procedure, which is under the CDC's 100 most common practices. So when we look at this example, it says that one hospital charges $91,000 for a gallbladder removal. Times that by 10,000 people getting the same procedure, that's $900,000. Then when you look 45 minutes away in St. Augustine, Florida, that procedure is only $40,000. Times that by 10,000 people again, that's $400,000. So basically, if those 10,000 people were to go to the other Floridian hospital, we would have seen a $500 million decrease. So what we're talking about with this is that we're going to streamline all prices to be more standardized throughout the board. And what we'll see with this is that Medicare is going to go down because the prices are going to be at the more minimum with the single payer tax system, because we're not really going to be seeing the profits in the procedures that's going on.
And also, if you look at the breakdown of who pays for healthcare in this country, 60% of all health costs in this country are paid in some shape, way, or form by the government. 20% is paid through private employers. Another 20% is paid out of our pockets, out-of-pocket costs, co-payments, deductibles. So under a government system, no longer would large corporations have to worry about their employers' health plans. That's money saved right there. They can use that money to hire new workers and build new factories and whatnot. And that's the 20% that's not coming out of our pockets. Again, that's going to help us too. If you were to replace the money that comes out of our pockets, the 20% that we pay right now as private citizens, with a simple 2% flat income tax increase, that would be more than enough to completely fund the system, and we would no longer have to pay that money.
Well, you just said the government accounts for 60% of healthcare spending, so you admitted it's not a free market in healthcare right now.
That's with Medicare, Medicaid.
Yeah.
Well,
Is it not a free market?
No, it is a free market because because hospitals and doctors are charging them as they like, as we just mentioned. The government is saying, fine, we'll pay it, because they have no other option. Under a single payer system, the government would, as I mentioned earlier, with the economies of scale, they would be able to give out a contract to one single company to provide more than enough, pacemakers, for example, and that'll be a lot cheaper. Instead of paying $100,000, they found a company that could provide the same pacemaker for $50,000 in bulk. That'll be a lot better.
Where's the incentive for innovating that medical?
That actually was a strong point. We were, in researching the NHS, what we found was that a lot of their systems are based on preventative care, and it was exemplified, like if you get your patients to stop smoking, or if you get them to have better living conditions, that would go along the lines of that. Obesity, cholesterol. What they saw was an increase. They get a bonus for that year. That's where the innovation lies. And then same thing for research companies. Research companies, the better they do, the more they're paid. It goes along on those lines. It's just a different form of incentives than we see now and are used to.
I wanted to say, you spoke about your 60%, your 20%, 20%. That 60% that the government pays, that's not the government, that's us. Without us, we pay taxes into it. So I think when you say that we're only paying 20%, we actually pay 80% because the government is us. So.
Well, obviously, the tax system is broken down differently. So the more wealthy pay more than other people. Again, it's a question of priorities. What do we want to fund and how do we want to fund it? If you don't want to spend too much on healthcare, then you'll see an unhealthy society like how we have right now. But if you do want to invest in it, you'll see the results.
And then when you do invest in it, investing in human capital is the best investment you can make for your company. So if you provide insurance for your employees, you're going to see that more likely to be in healthier conditions, less likely to take sick days. I believe it was $260 billion are lost every year in this country due to sick days and health risks.
I have a question now. In regards to, you said investing. If I were to invest and everyone else in this room were to invest, how do I know we're all going to get the same exact quality care? If
You
not
can't
better?
prove exacts, but you can prove increases. So it's, for example, not to dwell on education, but if you invest in a worker who has, an educated worker, if you pay for their MBA, you're gonna see that they're gonna be more efficient, more productive. It's the same thing with health, but health, if you're going into work sick, you're not gonna be productive that day. But if you have the health insurance and you're able to get healthier, what you're gonna see is that worker's gonna be like, yeah, I'm ready to work today.
And I was just curious, can you guys show an example of a nation that has better healthcare and better healthcare outcomes we do with less regulations and more diverse competition in the free market? Because I
Yes. Singapore. Singapore has higher life expectancy, lower infant mortality rates, spends only 4.4% of GDP on healthcare. And what they have, it's not laissez-faire. They do require people to put a certain amount of their paycheck into a private medical
Oh,
account.
medicine.
They do also assist the terminally ill with medical care and the very poor. Other than that, everybody pays for out-of-pocket for everything. And they spent way less on healthcare with better results. So it is possible. We saw it was possible in the U.S. before the government stepped in. I would also like to say your preventive care argument, I think, is a great argument in favor of free government fruits and vegetables and gym memberships, but not necessarily government running the whole system. I think if you wanted the government to subsidize like preventive care in some way, that's a different story than covering the whole
Actually,
system.
when you look to countries like Canada and England, most of their health system is fees, like 60%, I believe, in England, correct me if I'm wrong, but is in the preventive care sector. So what they're seeing is the better results by focusing on that, because it's much
They
cheaper to
pay
pay for a
for
patient when they first realize they have cancer than when they're in stage, I believe, 4 of cancer on the table trying to
They
bring
have
it.
higher
I mean,
cancer mortality rates. They have worse outcomes in health in Britain.
ultimately, the United States is the only industrialized nation on earth, Western industrialized nation on earth, that does not have the single payer system. Norway, Denmark, Sweden, France, Britain, we can name them all. They all have the system, and they all have better healthcare outcomes for us than us, and they pay less.
They do not have better healthcare outcomes than us, as I have shown.
They do.
They do not. When you take out fatal accidents, we have a higher life
But then when you
expectancy.
look at other factors like infant mortality rate,
Which, like I said, if you look at that,
obesity,
Lower cholesterol rates, lower
diseases.
smoking rates, lower.
that has nothing to do with
That,
healthcare.
that has everything to do with health.
That's people's life choices.
That's the individual's idea of preventive care. If I didn't want to get lung cancer, I wouldn't smoke
Okay,
cigarettes.
I'm gonna have to rally this up because the audience is starting to get into it. Everybody's getting a little bit cloudy. There's only 6 seconds left anyway.
6 seconds more just spoken. Freedom of speech.
Feel free to overthrow the moderator. But I'm
Leave it to a
going to
plebiscite.
take questions. Let's see, all the way in the back.
You seem through your comments to be putting a great deal of faith in government. When you talk about you went to Turkey and everything was paid for, it was wonderful, it was paid for by the Turkish people and their taxes, you're giving the impression that it's just because the government's paying for it that it's free. It's not free. And
We don't
already
believe it's free,
16
actually.
Wait
We
a
do
minute,
believe
wait
that
a
we are
minute.
paying it through taxes.
Wait a minute.
We do, but we only see in our single payer system, that's gonna be a 2% increase.
Okay. Now I'm in a train of thought. Oh, you're also talking about the government running it would be better. The government, it's notoriously famous for being inefficient. Anything that the government runs, it's inefficient. So I don't see that. The young lady's talking about the government, that your suggestion, your plan would put greater emphasis on life rather than profit. The government, again, is not famous for having an attitude of sanctity of life from conception till natural death. So, so I just think that some of your premises I question.
I'd like to interrupt. While I admire everyone's ideas, I'd like to keep it a question format, more questions, and just so we can keep it rolling. I'm sure everyone has valued opinions. It's no disrespect to anyone, but I'd like to keep it more in a question-based format so we can have response. One more of, all right, Steve Lumen. Oh, Casey.
Thank you. Well, we talked about like preventative care and the personal choices that we make that particularly as Americans, I think we're inclined to maybe engage in riskier behaviors or say, oh, you know, it's not that important to go to the doctor. If I'm going to miss work, it's not that important to stay home and get better because we put all this emphasis on work. Are we suggesting that the government needs to, in some way, incentivize things like fruits and vegetables and gym memberships and quitting smoking for the individual? Because those things will drive our healthcare costs down as well, but then that's a lot more government intervention in our lives.
If you look at people who do make good health choices in their lives, it's usually people who do routinely go to their doctor, make their appointments, get their checkups done, you know, get their immunizations and whatnot. But right now, there are millions and tens of millions who do not have access to a doctor. They cannot afford to regularly go to a doctor, and therefore they don't get the education that they need, that they should make better choices. Under our system, everyone will be able to see a doctor as they like, and it'll be a lot better for everyone.
I respond to that. Okay, I'm just wondering, you're bringing in millions more people into the healthcare market. Millions more people would supposedly take advantage of that preventive care, but you're not adding a single doctor.
Actually, with that, we do agree with you guys that there is supposed to be a doctor shortage. We were proposing a system with this in countries that do have single-payer systems, socialized systems. What we see is that they incentivize people to go to school, to be doctors, to be nurses, etc. So with that, we do agree that we have to incentivize a way for more doctors to be encouraged.
And also, if you look, many aspiring doctors, they don't go into primary care anymore. You see more and more people going to specialist fields because they can charge more there. You know, if you make it flat across the board, it'd be a lot better for people to stay in primary care.
I agree.
I'll take one more question. Let's see, I want to be fair and give it to people who haven't talked. I don't think I've.
You guys really emphasize government control over the healthcare system, but would you also say that you would also impose or continue to impose government regulations? Just citing one example, the FDA's regulations on medicine prevent new medicines from coming into the field for up to 14 years, which that's 14 years of people that are dying that could use that medicine. So with increased government involvement and government paying and fronting the bill for every American in this country to have health care, wouldn't you think the government would want to regulate that care?
With that FDA restriction, that's more about like business restriction. It's basically, I believe it has to do more with patents, correct? And so that business that produced the medicine can develop, have safer results, do more test trials. It really has nothing to do necessarily with the regulations, I believe, that you're talking about. It's more of like a business practice.
I would just like to give a little detail on what I think you're talking about. The Fowler-Harris Amendment of 1962 is in fact a law that requires the FDA to make the development period of pharmaceuticals 14 years. So that is a government regulation on pharmaceuticals. It accounts, this is Dr. Mary Ruwert, estimates it accounts for 85% of pharmaceutical cost and has resulted in at least 4.7 million deaths since the passage in 1962. How do they calculate that? Well, consider, for example, a pill that would very much save somebody's life, but since it's going through 14 years of development as opposed to the 4 that it was before this amendment, that's people that are dying that are not getting the care.
But we don't know that it's safe, and we don't know that it would necessarily
Right,
save
we need some
anybody.
form of regulation to make sure we're not bringing in drugs from China and that are
I'm
going
not
to poison
arguing
people.
against regulation. I'm saying it was 4 years before, then it became 15, and it has saved very few lives. The reason this actually happened was not because you had mass deaths from bad pills. It was because one pill killed, I think it was less than 1,000 people. And when you consider 4.7 million people have died over since 1962, it's actually killing more people than it's saving. I think that's a very important point. So not only does it account for 85% of pharmaceutical costs, which would greatly reduce the cost of healthcare, but it actually results in many deaths of people not getting medicine that they otherwise could.
What do Republicans think about FDA over regulation?
I do think 14 years is too long. I'm not saying there shouldn't be any time limit. I think 4 years might be a little too short. But it's a tough call, because I mean, you really don't want to just start throwing drugs out on the market, but 14 years is an extremely long time. That's, you know, more than almost all of ours, more than half our life.
Don't you think there's some scientific way, like we didn't choose 14 because we were like, how can we make it the longest time period possible? We chose 14 probably for a reason. It's probably like the standard, like that's actually when you can know if it's safe. Do you know what I mean?
I think you're absolutely right, but I think
Yeah.
it's time to revisit that.
We
Like
can
many
see if
things.
it's.
Right, I mean,
So I think
14
there's
years
actually-
probably is a little too much.
Yep.
So we can work.
I think we have a point of consensus on regulatory prescriptions again.
Yeah, I'm just a little more extreme than the rest.
All right, I'd like to move on to a question that is equally important. What is your plan for the future of Medicare and Medicaid? I'll start with this one.
Medicare and Medicaid are, you know, both equally important. You know, caring for old people through Medicare is very important. You know, helping the poor through Medicaid is also extremely important. We don't want to get rid of these programs. We're not saying, you know, defund it completely. But we really do need to address the rising costs of healthcare. Our friends the Libertarians, they brought up the education. It does tie in very closely. You're basically telling insurance companies that, or not insurance companies, healthcare professionals saying, hey, no matter what you charge, the government's going to pay for it. Hey, college, no matter how much you raise your tuition, the government will cover that loan. That's the problem with Medicare and Medicaid, is that you're kind of writing a blank check. Not completely, but, and then just even looking past, delving further into the problems of Medicare and Medicaid, there's a lot of doctors who won't even accept that as payment. So I think we really need to address that, because that definitely is a problem as well.
Right, like you said, it all comes full circle with government and business interacting. So what we'd like to do is try to get as much government out of Medicare and Medicaid as possible, even though they are government programs. So what we want to do is drastically reduce Medicaid coverage and not eliminate Medicare, but sort of consolidate both the programs into each other. As far as Medicare goes, the cost of Medicare is expected to double in the next 10 years. And also Medicare is kind of, I guess, progressive in that today's elderly are wealthier than they were at pretty much any time period. The baby boomers are doing pretty well. But it's usually the younger people who are working and struggling right now who are working to pay for their medical care. And this doesn't seem very productive, especially when you have programs such as Medicaid who try to help the younger working but poorer people. It's just, it really, like, where do you go from here?
Yeah, and I think an important point about that is a lot of people will bring in the moral argument here, like, why would you want to defund parts of Medicare and Medicaid? Don't you want to help the poor? Don't you want to help the elderly? But I think it's important to look at the actual result of the programs. When they were implemented in the 60s, it was to help these people, and now it has been one of the main causes for the tremendous price inflation of healthcare, which has made it less affordable. Additionally, Medicaid, surprisingly, the New England Journal of Medicine found, so did the RAND Corporation and the University of Virginia, there's a lot of studies on this, people with Medicaid actually have no health advantage over those without insurance, meaning the government-run insurance isn't very good. And in fact, in some cases, you're more likely to die because, like they said, a lot of doctors won't accept it. So I think it's a very important point to show that Medicare and Medicaid don't necessarily help the people they set out to, and I don't think it would be a huge disaster if we cut large portions out of both these programs.
We feel that Medicare and Medicaid are necessary in our society. We do agree that there is room for improvement though. There's great amounts that could be implemented so that the system is more efficient in its practices so that the costs are cheaper. So going back to what we said with streamlining and standardizing the prices, that brings down the cost. As we stated, just with the gallbladders, that could bring our cost down, or by, how much was it, 500 million, which is $500 million. That's one example alone. Repeating that and using a multiplier effect on that, we can see that the prices are going to be able to drop if we were to standardize it. Also with this, we do feel like there is room for improvement, especially with doctors accepting it, the quality of care that is given out and such. but we feel that streamlining it is going to make it more efficient, and if we pull it into our single payer system, we're going to see that everybody is able to afford healthcare necessarily, but that Medicare and Medicaid will be improved. You're making that.
Right, I mean, again, it's the medical cost, once you bring down the cost of the pacemakers from 100,000 to 50,000, that's gonna be tremendous savings, and you can cover everyone with that. If there is any gap, again, a 2% flat income tax would tremendously help fund this program. I mean, there's no reason to get rid of these programs when they already help millions of people every single day.
And especially at this point, we really can't take it away because our seniors do rely on Medicare, for example, and they've already put into the system. It's not necessarily, I would guess, say fair to take it away at this point.
And I'll open it up for roundtable.
So we all agree we don't want to eliminate Medicaid and Medicare. That's exciting.
I was just curious how you guys felt we should deal with the donut hole, as it's called, in Medicare Part D.
Well, under our single payer system, there wouldn't be a donut hole. Again, Medicare and Medicaid would be covered into our new system, and all health costs would just be paid.
Okay. So, sorry.
Well, one question I had that you guys keep bringing up is that the standardizing of prices would reduce costs, which I think it might. I completely agree we need price transparency. That is, a lot of people, when they get medical care, we don't look at prices at all. It's very strange. Imagine if we went to the supermarket with food insurance and we'd all get filet mignons because we're not looking at the prices. So the one law I would actually favor here is a law that requires medical practitioners to post their prices so people will actually see what they're paying for. What actually reduces cost is when prices compete with each other, not standardizing. So Dr. Keith Smith in Oklahoma City, he's a libertarian doctor, he's a surgeon. He got this idea to post his prices of all of his procedures and see what would happen. He found out he could actually do all of his procedures for on average half the cost, and it forced everyone around him to charge much less as well. So I don't think you necessarily need to have a government-run healthcare system for that. I think just some sort of price transparency, however you want to accomplish that, whether it's government regulation or whatever, would greatly reduce cost.
And also, the New England Journal of Medicine found in 2008 that we also have an excess amount of expensive technology. So that's stuff like CT scanners and MRI scanners and luxurious surgery suites that we don't need. And under a single-payer system, that excess capital, that excess equipment will be more evenly distributed so that people who don't have access to MRI scanners will be able to get it at an affordable, it will be affordable to them, bring down health costs.
Well, technology is not the reason for health.
Oh, it's a major,
No, it is
it's
not.
a major health cost.
It is not. What do I have here? I have this somewhere. Innovation. Basically, studies showed that in states with better technology, you had higher outcomes with less government spending on it. Technology, by definition, is made to make things more cost efficient, or else businesses wouldn't use them if it was more costly.
Innovation
I
is
believe that. I believe that too. Like, innovation is supposed to drive down prices, but we're kind of seeing the reverse effect in that as like the more expensive technology used in the healthcare sector, the higher that they can charge for prices. I believe that in most business models, that's how it works, but I think the opposite is happening in the healthcare industry.
Okay.
Thomas Frank Wickenberg, I found it. Okay. Well, this is a study showing medical innovation increases life expectancy while simultaneously reducing costs. That's all. It does exist. I'm
He didn't
crazy.
read that into
I make it up.
I'll take 2 questions if we have any.
Question for libertarians. Who would regulate that business practice to have doctors post, their prices out in front so people can see what it is?
Yeah, like I said, that would be the one law I'm actually in favor of.
Yeah, government
Not literally the one law. There's other, like I said, I'm not in favor of eliminating.
You should know what you're paying for. That's
Yeah,
But if so government.
Yeah, they can do that. That is a minimally intrusive law, I feel like. I can live with that.
It's posting your price. I mean, it doesn't matter what the prices say, just that you're.
If it's between post the menu of your prices and let's take over the entire system, I'd rather have the menu.
In fact, you'd be more incentivized by posting your prices because, again, you'd be able to compare prices and therefore everybody will be able to.
You should every shop voluntarily just say, hey, okay, that's fine, I'm gonna go ahead and post my prices out there.
Well, I mean, when you're looking, when you're looking for healthcare, like you're looking for other things, you're going to find what's the most reasonable price, but also what is the better quality one. So you're going to match quality and price. You're not just going to cheap out and buy something, and you're not just going to go extravagantly spend money on something you don't feel like you benefit from. People, what the government really doesn't, I don't want to say understand, I don't want to say understand, but what they really don't take into account is that consumers are human beings who can think for themselves.
Take one more question. Let me see. I see 2 hands. That didn't do it.
I had a question in regards to kind of paying everyone evenly. Wouldn't that sort of eliminate competition for doctors to be better? Because why would you want to improve yourself and work harder if you're going to get paid as a guy who's working less and not giving as good care?
We talked about that earlier. Actually, in systems such as England's system, the NHS, they actually still have competition factors with innovation. So it was a lot of like, if you get your patients to stop smoking, if their cholesterol levels are lower, etc. What you see is that you're going to get a bonus that year, and your wage is going to go up from then on. So that it's a different form of competition than we're used to, as I said previously, but it's still a motivating factor because that bonus could mean you get a new car, you get a new something.
And we're not advocating socialized medicine, so we're not advocating that doctors and hospital workers become government employees. We're allowing them to keep staying in the private practice, but we're advocating socialized insurance so everyone will be able to afford it properly.
Okay, I want to get to one final question where we can do the full cycle. And since it is the most relevant and it's a little bit interesting, since in this debate we have a single payer argument and not the current plan, what aspects of the Affordable Care Act do you agree with and disagree with, if any?
Sure, pretty much all of it we disagree with, except, well, I think they took it out, I'm not sure. But you're covered under your parents until 26. I'm in favor of that right now.
Other
than that,
I want to go on record as actually saying I'm actually against that. I feel like by the time you're, out of college, you should be responsible enough to pay for your own health insurance. You have to rely on your parents till you're 26. I mean, I don't want to live with my parents until 26. Like, you're certainly not going to expect them to pay for my health insurance.
You don't have to stay under your parents' insurance. You're able to.
Right.
Yeah.
Right. So I don't think you should even be able to. I think that's unfair to.
I would like to remind the panel and the audience that this is
that was part of my 5 minutes.
Okay.
I knew Joe would be okay.
Our turn? Okay, what we like. It beautifully illustrates how good intentions often result in the opposite effect.
Took the sarcasm approach.
Proves how government cannot even run a website, let alone our health.
Libertarians spend a lot of time on the internet, so we've mastered YouTube sarcasm.
Yes. Okay, what we don't like. Take it away.
What we do not like, first and foremost, individual mandate. It's on paper, at least, it simply looks like an expansion of Medicaid. The cost, obviously.
Mind you, Medicaid has no health benefits.
The CBO estimated it would cost $900 billion, and every single time they renew the study, the cost just keeps going up. Despite this, in a time we really can't afford it, 30 million people will still be uninsured. On the short term, right now you can see, it's getting pretty chaotic. Millions of people are finding their plans canceled. You'll go to your doctor tomorrow, he'll say, I can't help you. And again, the cost for the individual, you'll see premiums going up for almost every single American.
Okay.
Right, so we don't find Obamacare as the ultimate solution to this. I mean, a good thing we can say about it is, for example, you mentioned 30 million would stay uninsured even after Obamacare, and that's true. Now, to be fair, it would have been 80 million without Obamacare. So one aspect, it does help. But ultimately, as I mentioned before, the free market is not the solution to this. I mean, the whole idea of forcing people to go out to the private market and buy insurance is an idea come up with the Heritage Foundation. It was, proposed by the Republicans originally. Yeah, right. And it was pushed through that. It's not the progressive, it's not the liberal solution. It's the progressive solution. The ultimate solution to this is a single-payer system. And they were originally going to go with the single-payer system if it wasn't for the $600 million the health insurance lobbyists pushed into Congress to make sure that it was defeated.
I'd also like to mention, I don't believe anybody mentioned this before, but a good aspect of the ACA is the pre-existing conditions, allowing everybody to be able to get it regardless if you have asthma or if you have heart disease. That's something that insurance companies weren't doing before, and that's something that greatly is inclusive in our society.
Do you feel that because, I mean, Medicaid, you would like the Affordable Care Act to like expand on what Medicaid, for example, could cover? I believe right now, all Medicare, for example, not only covers the elderly, but it also covers people who have Lou Gehrig's disease, for example. So this is just a general question. So you feel like we should basically expand what types of conditions should be covered?
Tremendously, we would say all conditions
Okay.
should be covered.
I just wanted to clarify
Right.
that.
What I would say about that is that's a wonderful argument in favor of covering those with pre-existing conditions, not necessarily the entire country. Again, what you're talking about is a government-run system. Government-run systems do not work well. If you want an example of a portion of the U.S. that is a government-run healthcare system, look at the Veterans Association, which is notorious for serving their veterans horribly. Why? Because it eliminates incentives to produce wealth. The government does not care about people, not even our own veterans. But you think they're going to produce good healthcare for 300 million of us? I do not think that's a viable argument.
I had a question for you guys,
Yes.
because, I mean, it's notoriously known that in Massachusetts, the legislature passed a bill that pretty much Mitt Romney I'm not going verbatim, but he said the whole nation should be modeled off of this. How do you defend that sort of seemingly hypocritical statement from your standpoint?
Mitt Romney's idea in Massachusetts, that's a state-run system. That's not a national state saying, every single person in the country has to buy health insurance. That was Massachusetts, through their elected representatives, said, yes, in Massachusetts, if you live in Massachusetts, you have to buy health care. To me, that's, pretty much, 10th Amendment. I mean, regardless of how you feel that applies, regardless of just having personal freedom to buy things, a state-run plan would be much better in my mind than a national plan. But that's kind of the difference for us.
Do you see any issues with like interstate commerce in regards to having each state being able to determine what kind of health system?
Well, not right now because you can't buy, insurance across state lines. So right now there is no interstate market. But I guess if there was, yeah, that would be a problem. And that has to be forced inside, I think, to really flesh out how you would make all that work. But first, we have to, make sure insurance companies can sell across state lines. I was gonna say, we keep talking about those 2 Florida hospitals with the gallbladder thing. I think you're looking at the 2 hospitals as if they're the same exact hospital. Maybe the one that charges an extra $50,000 is 6 times as big and has 10 times as much staff. Like you can't really just assume that.
They actually did take into account those statistics and the methodology. They took out the factors where it was if there was a longer hospital stay and et cetera. But coming down to it, it was the 90 versus 40 for the single payer, or the single operation.
And also, for example, there were 2 hospitals in Dallas run by the same company. One charged $14,000 to treat pneumonia, the other charged $38,000. Again, we need that streamlined centralization, which allows flat prices across the board and a lot more affordable.
Across the board. Now, do you mean like by state or by city, by nationally? Nationally across the board. Okay.
Again, that you're arguing in favor of a market mechanism, right? You're arguing in favor of people seeing what the price is and saying, oh wait, this hospital a few miles down the road charges like, what was it, how much less? All you have to do is have people post their prices. You don't need to have the government control the entire system in order to produce the same and even better results than you're proposing, because standardizing does not mean costs will continue to go down, however competition does.
That would help, we agree with that, but that's not the whole scale. That's like not taking everything into effect. That's getting rid of one problem, whereas healthcare is a more massive and broad issue. We can't just focus it down to this one sign is going to do it. And also with the signs, there's going to be problems with that. Basically, what we're saying with that is not everybody's going to adhere to those, even if it is a government regulation necessarily, because of prices, because there is such a business aspect to it.
What do you mean not adhere to it?
In the sense that there's going to be something that gets around it, like there might be a lot of lobbyists with that. There's so many conditions because it's just a sign.
Restaurants don't cut around the menus. People will still look at the menu prices. That's the idea.
Like to talk about.
That's what drives food costs.
And you have to remember, some of the most expensive, things that a hospital can carry out is things that happen in emergencies. So if someone's in an ambulance, they don't really have the choice to say, oh, take me to that hospital instead of that one.
Well, I think another problem is too, it sounds all good, but when you have the same prices across the country nationally, even here in Pennsylvania, you can have the same price in Philadelphia, but in, State College or those surrounding counties, those people can't afford that, so they have to not only have travel costs, all that goes into effect too. It sounds great if we're gonna
And we
pay for
agree
it all,
with that,
but
but
my
if
taxes
it's-
go up and I'm gonna be hurt on that.
But it's
too.
not necessarily fair that, okay, say if you're talking about major cities like Philadelphia, it's not fair to charge them more because they can pay for it, whereas in the rural areas in the middle of Pennsylvania, they're not charged as much. That's like not across the board. And if you're that person in Philadelphia, you're basically gonna feel like you're gypped. Like, why didn't I just go to State College to get my pacemaker?
Because that's what the free market would do. The free market's objective is to charge as much as you can for a product. Now there's nothing wrong with many things in that aspect.